See, cervical cancer is a reproductive tract cancer which happens in the lower part of the womb or the uterus. The exact cause of cervical cancer is not known as like other cancers, but the risk factors are there like human papilloma virus. Two-thirds of the cancers are caused by human papilloma virus. This is a sexually transmitted virus which can later on lead into cervical cancer. Initially, it affects and leads to abnormal pap smear and cervicitis. And over the years, it can convert the cervicitis into cervical cancer. Like all reproductive tract cancer, cervical cancer can come with abnormal uterine bleeding. Patient can present with irregular periods, intermenstrual bleeding, bleeding after intercourse. There can be bleeding along with severe pain during intercourse. There is whitish or abnormal vaginal discharge. Later on, the patient can complain of pain, pelvic pain or lower abdomen pain with leg swelling or abdominal discomfort. Cervical cancer is a disease which is mostly caused by human papilloma virus. So those people who are at risk of contracting this infection, like people of low socioeconomic group where the hygiene is very poor, those people who get into sexual activity at a very early stage, there is a risk of cervical cancer because the reproductive tract is not matured enough to handle. So there is an increased chance of getting the infection, multiple sexual partners, multiple deliveries. These all lead to human papilloma virus infection, which is the major cause of cervical cancer. The other risk factors are smoking, repeated pregnancies, multiple sexual partner, delivery at a very young age or sexual activity at a very young age, immunosuppressive medicines or HIV patients, then poor diet, poor hygiene. These are the factors which can later lead into cervical cancer. Cervical cancer is the first reproductive tract cancer in female which constitute 80% of total reproductive cancers. In females after breast cancer, cervical cancer is the commonest cancer in India. India has a huge burden of cervical cancer just because of the low socioeconomic status, poor dietary habits, multiple childbirth at a very young age and chances of HPV infection. Possibility is there because poor menstrual hygiene always gives a chance of infection. To add on that, if an HPV infection is there or a person is getting repeated cervicitis or cervical erosion which is not treated over the years, it can lead to some abnormal changes, thereby causing cervical cancer. The most important thing is cervical cancer is the only cancer caused by virus and we can prevent it. Vaccinations are available. So it is advisable that vaccine should be given to all girl child by the age of 11-12 years or before they enter into sexual activity. And once the person is sexually active, every year she should be screened by a pap smear test. That is the thing which helps us to detect cervical cancer at a very early age. So proper screening techniques with pap smear and added to it vaccination gives us a good protection which can help the young generation to keep this disease which is very deadly but yet it is preventable. There are certain screening tests for cervical cancer. Pap smear test is the first test which we do. In this, we do a vaginal examination and the scrapings from the cervix is taken, which is seen under a microscope to detect any kind of abnormal cells which can be due to infection or there can be malignant cells. Pap smears are recommended for females above 18 years who are sexually active. It should be done once in every year. If 3 pap smears are negative consecutively, then we can increase the time frame for doing the pap smear test. But it is the only best test which is low cost and it can be done very easily in any setup. See, if there is a start of sexual activity, after 1 year of the sexual activity, ideally the female should undergo a pap smear. Or if she is more than 21 years and married, we should go for a pap smear test once in a year. If 3 consecutive tests are negative, then we can do the pap test once in 2 years. But after the age of 40 years, it should be done every year till the age of 65, 70, because as the age increases, there are chances of getting any kind of cancer more. If detected early, definitely it has a good prognosis. If it is early detection, is early diagnosis and prevention will help the cure of the disease. So it depends upon which stage we are detecting the disease. Since cervical cancer has a long gestational phase, it is caused by human papilloma virus, and it takes around 10 to 15, sometimes 20 years to develop the cervical cancer. So during this phase of time, if we are doing a repeated screening and some abnormalities are detected, so then there is a fair chance that we can treat these patients without going for major surgeries. And even we detect it in a very early stage, like stage 1 also, or in CIN stages, that is precancerous stages, there are surgeries which can be life-saving, and there is a long-term prognosis which is very good. Even in the second stage cancers also, we have very good surgeries along with chemotherapy and radiations, gives a very fair chance of survival. The treatment modalities are usually the surgical part, the chemotherapy and the radiation. But before that, when the cervical cancer is in the precancerous stages, there are other treatments available which are not very invasive, and we can treat the patients and stop the disease at that level. Then we can do loop excisions. There are cauterization techniques available which can limit the disease if it is in the precancerous stages. But once there is a full-blown cervical cancer, then we have to go for the surgical treatment. And if it is in the early stages, only surgery is sufficient to treat the patient, and we keep the patient in follow-up. But in later stages, we can add on chemotherapy along with the surgery, or radiations are advised. Cervical cancer, if detected in a precancerous stage or early stages, the chances of cure is very high, and there are very less chances of developing relapses or metastasis if diagnosed and treated properly in the early stages. HPV is a vaccine which is developed against human papilloma virus. It is basically an immunoglobulin. Like other viruses, it is not a live attenuated vaccine. Here we are not using the virus to create a vaccine. Rather, we are using an immunoglobulins. These immunoglobulins, they stimulate the immune system of the individual to fight against these viruses, and thus they protect the body from contracting this infection, which can later on lead to cervical cancer. So this vaccine can protect a person from getting cervical cancer. And HPV virus not only causes cervical cancer, it can cause genital warts, it can cause cancers of vulva, vagina, even oropharyngeal cancers can be caused by HPV. So if we are vaccinating somebody with HPV vaccine, we are preventing all other infections also, which can later lead to cancers of those organs.